everyone. Yay.
Good morning, everyone, and thank you for that awesome South by Southwest welcome. It's almost like there's someone that you're really excited to see here this morning. My name is Catherine Casey. I'm the co-founder and managing partner of Acumen America, and I'm really honored to host this conversation today. At Acumen America, we invest in early-stage companies that are tackling issues of poverty across the United States. To date, over the last 10 years, we've backed almost 50 founders, extraordinary founders like Mika and Kwame, who are tackling some of our country's hardest challenges. And I'm incredibly excited for us to talk today about improving health equity in America. Health equity is a really simple concept that your background should not determine the quality of care that you receive. But the reality in America today is that your zip code is more deterministic of your life expectancy than your genetic code. So in Austin, where we sit, neighborhoods just 3 or 4 miles apart will have a difference in life expectancy of almost 20 years because of different access to doctors, food, education, and other resources. Now, Serena and I get to meet entrepreneurs every day who are trying to change this. But what we often see is that the entrepreneurs that are best positioned to solve these challenges are overlooked and underfunded because of what they look like or where they come from. And all of us on this stage believe that if we can change that, we can drive innovation to where it's needed most and help improve health in communities across the country. So with that, we will kick off with introductions. I have the great pleasure of beginning with the GOAT herself, the extraordinary 23-time Grand Slam winner, global icon, entrepreneur, someone I've come to know as a really remarkable investor, and catalyst entrepreneur in residence, Serena Williams.
Thank you.
Serena, would love to start just hearing a little bit about your journey and your role at Catalyst.
Well, my role has been really exciting, as you know, at Catalyst as an entrepreneur in residence. You know what I really love? Well, also as a VC, I love investing. I've been investing for over 15 years now, and also with our fund, Serena Ventures, we do a lot of investing in underrepresented founders and women, and also just great investors. We really take away that line of diversity and just invest in great founders and great people. And so that's what we like to do. And now what we're doing here is quite interesting because we've seen a lot of really amazing founders that are solving really big problems in their communities. And as VC, we don't often look, we're always looking at huge numbers and huge returns, which is great, by the way. But that's one thing that I've loved at Catalyst, is we're putting money behind entrepreneurs and others as well, but over 200 women and underrepresented founders that are actually solving problems in their local communities. We were in, what was it, Paris or London? Cannes, France. We were somewhere in the world, and we met some really great entrepreneurs that were solving the water system and how to clean water, because it was impossible for their kids and their families to be able to have clean water, which was affecting their children, which was killing their kids. And as we think about it, the future, that's their future. They didn't have one if they didn't have their children to live onto that. And so we met some amazing women, 2 different companies actually, that was really attacking that problem at a local level, which is something that we're doing at Catalyst. So it's been really great to be an entrepreneur in residence and to get on calls and to get on Zooms or to meet in person some of these founders and just help them in a different way than you do that a lot as a VC, but this is different. It's really exciting to just be elbows deep, hands down, really answering questions, really guiding some of the entrepreneurs and really helping them with their journey and explaining to them what makes a successful founder and how to keep going as an entrepreneur and how to keep building, and what is the problem in your community and how are you going to solve that problem and how can we help you solve that problem. And so that's what I'm doing here as an entrepreneur in residence, and it's been really fun, and it's been really exciting to be a part of something so just moving, just something so moving and so creating and helping so many people.
Yeah, and you're already adding so much value, and we're just getting started.
Yes.
Ryan, would love for you to introduce yourself next.
Yeah, great. Hi, everybody. My name is Ryan DeLay. I'm here on behalf of Reckitt. Now, some of you may not necessarily recognize the name Reckitt, but you'll probably recognize some of the brands that you use on an everyday basis, from Lysol to Mucinex to Finish dishwashing detergent here in the US. And for those of you joining from around the world, brands like Dettol, Strepsols, and Durex around the rest of the globe. For over 200 years, we've had these brands providing benefits across health and hygiene for consumers all around the world. And what's been core to us on that journey, whether it's fighting Spanish flu or COVID with brands like Lysol, or taking care of consumers' everyday needs through cold and flu illness with brands like Mucinex, is really helping improve the lives of an everyday basis for consumers. What I love about our portfolio is not just the sales or the revenue it generates for our company, but the good they do on a day in, day out basis, helping individuals live healthier, happier lives as they move through. As part of our journey as Reckitt, and over the 200 years we've been there, we also believe we have a responsibility beyond that to help provide positive hygiene and health outcomes in the communities in which we exist and where we serve as well. That's part of the reason why I'm so thrilled to be here with this great group of people, having fantastic partners like Acumen, with Catherine joining us here on the stage, Serena obviously playing a key role in this program as we've gone forward, and then Kwame and Mika as a couple of the representatives for the entrepreneurs that we've been supporting through that on the journey that we're going to go on together to continue to make the world a better place.
And I have to just say something to that. When I first had an opportunity to talk with Reckitt and meet with them, they didn't want me to be a brand ambassador. They're like, the last thing we want you to do is be associated with our products. Like he said, you may have not heard of the company, but you've definitely heard of a lot of their products. And I really appreciated that, because it was really a point that they wanted to make, that they're really genuinely here to help founders. They're really genuinely here to pick up that conversation about health and hygiene and across the globe, and how much that affects everyone. And that was just something I had actually never heard before, and it was so refreshing and so authentic to hear and to be a part of something that is so much bigger than, you know, what they already do in a different way. And I really just wanted to say that.
That's fantastic.
Yeah, it's really groundbreaking work for a global corporation. Mika, can you introduce yourself and Malama?
Of course. Hi, everyone. Mika Eddy. So honored to be here. We're actually Acumen and part of the Reckitt program. As a Catalyst entrepreneur, we're the latest to add to the portfolio. Malama means to nurture, take care of, and Malama was born out of my personal experience with 3 high-risk pregnancies, and also after growing up with a grandmother as an OBGYN. We created Malama as a community-based doula powered with technology, remote monitoring, and preventative care for chronic conditions in order to dramatically improve maternal health outcomes in this country. So very excited to be here. Thank you.
Thanks, Mika. Kwame.
And hi, my name is Kwame Liddell. I'm the founder and CEO of ThriveLink. We build AI agents that talk to people and help them sign up for things like food, housing, transportation. We started out because I'm an emergency department nurse, and I traveled to all these places where families were losing their lives, their well-being, having strokes, etc. But they didn't need to. There were programs that we knew existed in the community that we could have helped them get that medication, or we could have helped them get into that housing program. But as a nurse, standing at the bedside, there was no easy way for me to say, hey, Ms. Jones, you need this, let me help you get there. So we built ThriveLink, started off as a nonprofit where we would just voluntarily help people do paperwork. And with supporters, we were able to grow, and now we serve hospitals and health insurance companies in more than 17 states, and we're just really excited to be here.
All right, so we're gonna dive in. We're gonna move fast and cover 5 topics: founder story, founder experience, branding, fundraising, networking, and growth. And then we really wanna hear from all of you, so send your questions in and we'll open up to a conversation at the end. I wanna start picking up on both of your incredible stories, Mika and Kwame. At Acumen America, and I know Serena, in your investing, we look for founders with real passion for the problems they're trying to solve, and in many cases, lived experience of those problems, because we think that often makes for the best businesses, and that it's particularly important in healthcare where trust and cultural knowledge matters so much. So would love, Mika, to start with you and hear about how your personal experience informed what you're building at Malama, not ThriveLink, and how you think that sets you up for success in the healthcare space.
Yeah, of course. And hopefully Malama will partner with ThriveLink in the future. So I mentioned Malama means to nurture, take care of. Our mission is to nurture and take care of mothers. We are in the midst of a maternal health crisis in this country. The US ranks dead last in terms of maternal health outcomes. That includes everything from postpartum eclampsia, postpartum hemorrhage. 53% of maternal-related deaths actually happen in the postpartum period, and yet we have one single 6-week visit. And other than that, which, by the way, women insured by Medicaid, which covers nearly half of births in this country, only about 30% go in for that postpartum visit. And I mentioned my grandmother. I grew up in Tokyo. I'm Chinese. My grandmother moved over from China, a long backstory. But I grew up really watching her deliver up to 30 babies a day, sometimes in rural Japan. And she also would tell me stories. Sometimes she would come home and say, you know, I held a woman's uterus, it fell out today. And just these crazy stories, and how embedded she was in the community and her work. She worked up until she got sick and unfortunately passed away. But this was her passion, and from the early stages, that was in part of my life. And then I had my own high-risk pregnancy. I was actually working at United Healthcare and Optum at the time, where Kwame was at as well, and realized that the system, especially in the US, was truly not built for healthy outcomes for women. And particularly if you do not have privilege or a platform, that oftentimes these outcomes are left to chance. And I had a doula for my first pregnancy, which was high risk, ended up being induced, and looked for this continuous care between visit that unfortunately our system is not designed for, given the prenatal kind of episodic care. But because I had a doula, and because I was fortunate enough to access that and to navigate, I was able to have I have a son who's now 5, moved through COVID and come out on the other end. But we really designed Malama in order to help fill the gaps and address the needs that we saw. And from day one, we've designed for those who are insured by Medicaid. So again, the nearly 50% of births that are covered by Medicaid, by providing continuous between-visit support led by a community-based doula who knows that corner wick has diapers today, or where car seats are, because you can't go home from the hospital without a car seat. And is able to connect to essential resources that fundamentally move the needle on maternal health outcomes.
Thanks, Mika. And Kwame?
My experience at healthcare started when my uncle had a massive stroke when he was just a few years older than I am right now. And he looked fit, he rode motorcycles, if you saw him, you wouldn't expect him to be someone who's gonna have a stroke soon. And he lived with my grandparents for the rest of his life and was able to walk and communicate. And that happened when I was about in middle school. Then my professional introduction, because from there, we saw what social determinants of health are without having a name to it. Because so many people in my family and communities had heart attacks and strokes or died in their sleep as they got older, and we thought it was something that's genetic. And my freshman year in college, I dropped out of college, and I became a janitor at the local hospital. And I didn't know what a teaching hospital was. There were like doctors, medical school students, and nursing students, and all those things in the hallways. And I was just really curious. And I stood outside of the cafeteria every day and just talked to whoever would talk to me about what they do. One day, I thought I was in trouble. One of the nurses called me in our office, and because I was just asking everyone so many questions. And she explained what healthcare was to me and how policies impact the things that happen and all those things. That day, I changed my major. I enrolled in community college, and I became a nurse. And as I was at the bedside working at mostly stroke centers, I kept seeing, I traveled Chicago, St. Louis, Houston, et cetera, all these places where I saw people who looked like me, were communities similar to mine, that were also having heart attacks and strokes. And there was a huge difference that I was seeing, that patients didn't need more health care. They needed food, housing, transportation. And my poor mentor at the time, she's now the president of the University of Louisville Health System. It was her first day as a chief nurse. And I might have been her first meeting with me complaining about all these people are so sick but don't need to be. I then became a lawyer, a healthcare lawyer, where I led at large health systems and health plans, where I saw the problem evolve just in a few years of my career from this is just something that's my family, to this is just something to the patients that I serve, to millions of people across the country that are being impacted. And one of the key principles that I learned just as a nurse before thinking about being a founder or building a product was we really thought about working with the communities directly to learn how to do this thing. And as we thought about how do we get a person who's sitting in a doctor's office or who just got health insurance, how do we get them to the wheelchair or home health or medication in an easy way? And where we started in that experience, I thought about my family. So thinking about building an app that someone has to download from App Store, you can forget it. That wasn't going to work if I thought about I wanted to build something that would be inclusive to my granddad. But something that we worked together with our partners was people might not be able to text or type within an app, but they can say their address. They can say where they live. They can say all the things that they need to get into these programs. So we built a telephonic AI agent that allows people to talk. And since then, we've helped thousands of families access healthy food, thousands of families. Someone won the Boston Housing Lottery, and just so many things that we get to see in real life. And it's one of the reasons that we are growing and expanding and being able to have these real stories and real impact on people. And we're just so thankful, and I feel blessed to be able to do that work.
Really powerful stories. And Serena, you often talk about the importance of having a story and then being able to sell that story. Can you talk about what you look for in a founder story when you're meeting founders and how those stories can become the cornerstone of a good brand?
Well, I think we just heard it right today from Mika and Kwame. For us, when we're at Serena Ventures and we're looking at what to invest in, we want to hear something that's authentic. Mika said something very true to her, that her grandmother had an experience in it. Kwame, the same thing, his uncle, and which drove him into healthcare. For us, when people are investing in things, and you probably see this all the time as well, because it's just a white space and there's a lot of money to be made, but there's no true connection to that, then you don't really have founders that are determined to stay and ask questions and go to complain about why things aren't happening. They're more a little lackadaisical about it. They're not as passionate about it. And so for us, when we're talking to founders, storytelling is obviously super important. You have to be able to tell your story in such a big way that, like everyone here, after hearing these two stories, have probably felt some emotional tug at you, right? And that's what you want. That's what you want your founders to do. And when I'm listening to these pitch meetings, I want to feel a tug, whether it's for something in the community or whether it's for an AI product. We want to feel something that also has a true connection, because when they have a true connection, we know that they're not going to stop. They're going to continue to knock down another door. They're going to continue to knock on another door, and to continue to they're never going to give up. And so that's something that's truly good to hear from our founders today. And also when I'm listening to different pitches, it's like we need to hear some true connection that you have. And what is that connection? It doesn't have to be something directly that happened to you. It could be a extended family. It could be friends, but it has to be some real connection.
So true.
Yeah.
And Ryan, Reckitt's home to some of the world's best-known health and hygiene brands. How do you think about the value that Reckitt can bring to startup entrepreneurs like Mika and Kwame when you think about your brand building experience?
It's a great question. Thanks, Catherine. Yeah, we've been building brands for over 200 years, and we have a set playbook within our organization of what enables those brands to be successful. What we've done as an entity is we've actually looked to define 240 individuals within Reckitt to help serve as mentors. These are not just people focused on commercial, but it's across the entire ecosystem a business would need to run, from supply to IT&D to regulatory, healthcare professionals that are critically important in some of the areas that these entrepreneurs are playing into. So this lets them tap into that expertise of those 240 people within us. Partnering that with then support and funding, in addition to that, enables us to hopefully achieve some great things together. What I'm probably most proud about is we have 240 spots for mentors. We actually had 240% over that number of people wanting to support. So we have fantastic mentors that we were able to pick from, spanning 23 countries around the world, who have, you know, tens or decades or hundreds of years of experience to be able to provide these.
That was nice. I got to be able to meet some of them just recently, like a week ago, to meet some of the mentors that Reckitt had. And it was really good to see the enthusiasm that they had and how they really wanted to genuinely help founders. And like you said, they come from all different types of backgrounds. So you not only have your entrepreneurs and residents, but you also have people that's been in the Reckitt and that's been able to really help the founders.
Yeah, it's amazing to see the interest and some of the early value we're seeing created for entrepreneurs. I'm going to shift slightly to the idea of fundraising, which is obviously one of the most important parts of building an early stage company. One of the constant themes in my 20 years of impact investing has been the persistent underfunding of female founders and founders of color. Serena, you and I have talked a lot about the less than 2% of venture capital funding that goes to female founders, and even less that goes to founders of color. And you and I have both tried to build portfolios that intentionally reflect the incredible diversity of this country, because we think that makes for smart investing. Mika, despite some of those huge barriers, you've been a rock star fundraising. You just closed a major seed fundraise at over $9 million from a wide range of investors. Announced it yesterday. Can you talk about your experience raising as a female founder in women's health and any lessons you can share from that experience?
Yeah, thank you. And yes, very excited about the announcement. It was a long time coming. And some of our very early day one believers are sitting in the room here as well. At every step of the way, you mentioned the 2%. That's something that we hear all the time. And at the same time, I don't want that to be defeating. I want there to be hope in the room. And at every turn, if you can find someone who believes in investing in underrepresented entrepreneurs, those who truly have the lived experiences, because we are the people who are going to be able to solve and bring about creative solutions to problems that have manifested for a very long time. And in order to truly change the system, you need to invest in the people who understand what it's like to be up at 3 in the morning with a bad NST result or an amniocentesis the next day, or a planned C-section, and to know what that feels like and that fear and anxiety that keeps you up between that 10-15 minute you get with the OB. And so investing and finding those people who open the doors. We went through Y Combinator. It's a tech accelerator, very famous in the Bay Area. We found our female partner for YC was a women's health founder herself, and she opened the door to other women's health companies. So look for Acumen America, who is our lead for this round. Similarly, our board member Vinu on the Acumen team, she leads the Medicaid Innovation Collaborative. So look for those people, be very intentional about who you bring on to your cap table as well, so that incentives are aligned and that you can continue to deliver on the mission. The other point I'll add is don't be dependent on any one type of capital. So we have been very fortunate to have gone after non-dilutive funding and received an NIH SBIR grant, which is something that's less talked about, especially in kind of the Silicon Valley and world. We also received funding through the state of California, and both of those are non-dilutive funding pieces, which just allows you to be less dependent on any single source of capital. So don't give up if the VCs continue to say no, no, no. They always say here 100 no's and you just need one yes. So look for those believers, look for those door openers like Acumen, like Reckitt, who believe in funding underserved founders who have that lived experience. and also continue to look for other sources of capital. Being an entrepreneur is just continuously reinventing yourself, and probably no one on stage has done that better than Serena. And you just you hit a wall, you pivot, you hit a wall, you pivot, and that's kind of the fundraising experience.
Serena, we share an entrepreneur in our portfolio who got 300 no's before we invested, and now they're valued at $1 billion. So you can, if you keep breaking down those walls, you can achieve a ton.
Yeah.
You hinted at this, Mika, but we know that it takes a lot more than capital to build an early stage company. You spoke about this as well, Ryan. It's access to strategic support, to networks, to people who can open doors for you. At Acumen America, we spend a lot of time connecting our healthcare founders to buyers, to policymakers, to those people who can help ensure adoption and success at the early stages. I was talking to that same entrepreneur the other day that we share in our portfolio, Serena, and he was saying one of the reasons he values you so much as an investor is that you don't just write a check, you really roll up your sleeves and help with it all that you can. Can you talk about how you've thought about that at Serena Ventures and the kind of role you play and how you think about that in the Catalyst context?
Yeah, that's what I love about the Catalyst context is that we have an opportunity to work with the entrepreneurs and help them and be a mentor to them if they have any questions, or they could also give us advice too. We learn so much at the same time. And what we do, and you know this, in VC, you can't just write a check. And as Mika said, it's so important who you put around your cap table, because checks are great, and you do want some of those too, but you also want at least one or two people that can really guide you and to help you decide what to do next, or what companies to do, or how to scale your business, how to scale your team, how to do so many things. And that's so important. And who you're referring to, I just really believed in what he's doing, and I still believe in what he's doing, and it's just really amazing. And so for us, it's like, we're not people that are just gonna sit down and write a check. We're gonna try to introduce you to people, we're gonna open a lot of doors, we're gonna pick up the phone and make lots of phone calls to get you where you need to go. And also we're gonna offer advice on how, from down to fundraising to building. And so I think when you look at a lot of great VCs, that's definitely what the best does. It's just, because at the end of the day, we want to succeed. We're spending money because we want them to be a huge company. That's the name of the game in VC. And so for us, it's only to our benefit, and sometimes to the benefit of the betterment of the community, when you do pick up the phone and you help make lots of introductions. VC is really about who you know, right? It's connections, introductions, and so that is the name of the game, and that's how we try to play it.
Yeah, and no one better than you to help amplify this work. So, Kwame, can you talk about that from the perspective of a founder, and what excites you about working with Serena and with Reckitt?
Yeah, there's nothing I can learn from like one of the most legendary athletes of all time. It's an incredibly exciting experience, because I think of building in our team, we think about it, we use sports analogies a lot. And it is hard to win, and I say even impossible, to build the thing that we want to do and eradicate the problems that we want to solve without a great team. And there are stages where that matters, and you think about it in different ways. And something that we're really excited about, we're a pre-seed company where we just closed our pre-seed round, and we've done all this introductory work. We have these introductory contracts and partners. I'm excited to even thinking about being in the room today. My mom's here, and John, my best friend.
Where's your mom? There she is.
There's Mom. And John, my best friend, who leads growth on our team, as we're thinking about, Mika used the term day ones, and you say, look, this is how we're gonna get started and build. I could say, even through our fundraising experience, being a first-time founder, Acumen's team helped us. Here's how you understand these steps. Here's how you have conversations with other investors and think about how you navigate this ecosystem that you haven't been in before. And now already, as we came into the program, we're connected to mentors and people who can help build our team in the back end, and help us think about, you've done really great in all these areas. How do we amplify it? How do we make it better? Settings like this even is just really an incredible and exciting experience to think about what is the next stage or next 2 stages that we're going in. And we've had the opportunity now with all of the support around us to just bolster that.
I feel like we need one more round of applause for Kwame's mom, who should get all the credit.
She's busy filming.
So we've covered a lot of aspects of early stage business building, and one thing that all of us are focused on at Catalyst is how to help companies move from startup to really meaningful scale and systems change. So we'd love to start with you again, Kwame, on what it's been like to start to grow ThriveLink in what's been a tough fundraising and policy environment, and what your aspirations are for scale for the company.
Yeah, we've had some really exciting things happen. I think as much as being a founder is difficult, it's equally exciting. And it's an important thing. When we started out, our team is really good at building this thing for our community. And we talked about how building something that's built by people who understand the community is important. And we were really good at that. We were also really good at partnering with the hospital systems, the health insurance companies that are experiencing these problems. Something that was really important that we were able to see working with investors and building out our team is that this problem, and investors even helped us understand how to apply this problem that we're solving in North Carolina and California. How do you apply it in Texas, in Minnesota, in Michigan? And it's really that guiding force even while we were raising. So I could say so much, the investors that support us now, and I think for founders it's important to think about those people and how they can support you and the type of questions they ask and the type of ways that they try to assist you, is that the investors that close with us were helping us all the time, from the first conversation to after we close and beyond. So what that allowed us to do was raise money and grow our company at the same time. So in the time from when we began to have our first conversations, we almost doubled our patient population in that same amount of time. So now, once we actually close and we have the dollars to go and expand the team, we're already working on that next level and that next step. So in this environment, though, typically if you tell that story in just a different time in a different year, that means that you closed in 2 weeks and you're good to go. So what happened in our experience was it took a little longer. It took a little longer. You had to bring more people in the room and be strategic about which investors were right, which investors had timing matters. So where are they in their rounds? We're understanding all of the nuances in the ecosystem. But now more than ever, I think it's important for founders to think about how do you continue to grow and show that the thing that you're solving, you are still relevant, you are building it in the way that will matter in the future, so that as investors are having to really make these hard decisions on where they support, that you are at the top of the list. Every time we talk again, we have some more things to follow up on, and we're able to share how we're growing in those experiences.
Thanks. Ryan, Reckitt's really placing a big bet on entrepreneurs here, and as I was saying earlier, it's really groundbreaking work for a company to do, not only with your capital, but with deep support from across some of the most talented people in your organization. How do you think about success for Catalyst and scale for some of the entrepreneurs that you support?
Yeah, it's another great question. I think we have been helping entrepreneurs around the globe for the last 5 years or so, and have just launched in the last year the Catalyst program here in the US, bringing on entrepreneurs we have here like Kwame and Mika into the mix. I think as we look at it going forward, our intent is to try to fund up to 200 different entrepreneurs around the world, 30 of which will be here in the US, and provide a significant amount of funding, but also provide that support and that help through the system to help people who have a lot of passion and a lot of expertise and knowledge in individual areas unlock the other business the fundamentals they need in order to really take and make their idea break through the marketplace, get the funding they need, and create significant impact for the communities around us.
Thanks. All right, Serena, last two questions to you before we open up to some conversation with everyone in the room. Mika, I can't remember if you said this or Kwame, that there's sort of no one better in terms of thinking about building resilience and building a growth mindset and continuing to break down barriers. Can you talk about how you've built that growth mindset and lessons for entrepreneurs on overcoming failure and continuing to push forward?
I think growth mindset, you have to want to grow. You can't just feel like you're already the best, or I've already made it, or I've already done this, or succeeded in this raise, and there's always a next one, right? And I always say that after winning a championship, I always say I don't really stare in the rear view mirror because I can't really see what's happening in front of me. And I'm moving forward, and the traffic is in front of you, not necessarily behind you. So for me, it's really important, and if people and founders that have that growth mindset, they're really open to continuing to be successful. It's almost this weird disease, like you just can't stop. You know, you want to keep going, and you have this insatiable desire to continue. Also, I think a growth mindset is someone who's also humble, because you have to be humble to take feedback. You have to be so humble to hear a no. I mean, we hear no's all the time, and I'm sure you guys do too. And like, you have to be able to continue and have that resilience to continue. And in order to do that, you have to have some sort of humility, right? And the second part of your question?
Overcoming failures. I mean,
Yes.
One of the things I remember you saying the last time we talked was, we were talking about how do you receive criticism or how do you handle critics. Yeah. And you were like, well, the good news is now the line is so long. I'm like, get to the back of the line. But how do you think about sort of overcoming failure and sort of dealing with
I don't
critics?
really, when it comes to founders and startups and entrepreneurs, I don't really think the word failure really exists. I mean, yeah, it didn't work out, but you tried. You only fail if you don't try. And I love that saying. I feel like also when I'm talking to founders, I want to know what you did fail at, or what you didn't succeed at, because that also shows me who you are as a person. It also shows me how you're going to continue to work and how you're going to continue to do, and that you understand what it's like to lose. And I think as much as, we all probably hate losing, it's so important because that's when you learn your most. Like, why didn't that work out? Why didn't that idea work out? Why didn't going in this direction work out? And you're never going to really understand that unless it doesn't work out, and you kind of need that. So for us, or for me, that's kind of how I look at it. I always try to change the way you view things. Perception, and just change it. Like, instead of viewing it as, oh, I failed, it's like, oh, that didn't work out. Why? And how can I make it better next time? And that, even just such a slight change and shift in your thought process and your thinking can really just change that whole conversation. I didn't fail, it didn't work out. And this is why I didn't, so now I'm gonna try it this way. And that's how you build success. That's how you become successful. And that's how you also stay resilient and positive. Because those are also very, very things that you need a lot in order to be a founder, because you have to have a ton of resilience.
So true. All right. Thank you all. We're going to come back to closing thoughts from the panelists after the Q&A, but want to open up now to some of your questions. And maybe the first one is a great one for Mika and Kwame, which is from Emma. How do founders balance designing for the specific community they know deeply while also building something scalable enough to reach millions? How do you hold that tension of depth and scale?
Yeah, thank you, Emma, for your question. So very early days, and on the note of failure, we designed a very rough prototype of, first we started with a patient-facing app built in multiple languages. We've always been Medicaid first, and it was a very, very rough prototype, but what we did was we put together, and it was for tracking biometrics, we pull like glucose levels, blood pressure, et cetera, and we built a mom council, and we just set up a group on WhatsApp, and it was literally just 10 women who were all pregnant and experiencing different, either complications, high risk, or just insured by Medicaid. We set up a group, and we literally just had this continuous feedback for cycle of putting out hey, what do you think of this? Does this help? How do you actually track your meal? Do you take a picture? You know, what are some of the apps you like? Instagram? Let's make it like Instagram, where you just take a picture, and maybe I shouldn't say that, but take a picture and have that loop. So it's just very easy to use, and also hopefully delights the user. So very rough prototype, but from the beginning, always incorporating that feedback to make sure that what you develop actually addresses those needs and will be used by the communities that you are intending to serve. And today we have 50,000 women across the country using it.
Wow. But you started at 10.
Start with a little mom council of 10.
Oh, I love that.
I think it's funny. I love the sentiments, and it's funny. It just word of advice. And if healthcare world is really small, so be nice to everyone. Mika and I worked together in the past and realized it when we came together to plan for this this panel. Ours started out as just a call. We were volunteers that would meet people in person. Then it was just a call center. So you would just call and talk to a person, and they'll help you fill it out. And for us, when you think about scale for millions, it gave us the time to learn what are the questions that people ask. What don't they understand about a Medicaid application or collect a prior authorization? People even know what that is. And we were able to slowly transition from a call center, one service at a time, because we got to take our time and understand how to make a really great experience for the people that needed it most.
So I have a question to add on to that. So the question specifically asked scalable enough to reach millions. When you started this business, were you trying to make it scalable to reach millions, or how did you both start that?
Mm-hmm. Yeah, so we started again from that group of 10. And
but was it in your mind like, I want to reach millions, or was it just, I want to?
We wanted to solve a problem for a specific user.
Mm-hmm. So,
and then how large that market was honestly debatable from the beginning. A lot of the VCs said, hey, this isn't a VC backable market because it's a niche problem. But we didn't believe that. We said, hey, this is a problem that affects, we know that I've experienced it. We know, at least these 10 other women experience it. And from Shadow, we worked with maternal fetal medicine specialists from very on. We knew that providers experience it, as well as the total cost of care, and payers experience it. And so we had this kind of first little ecosystem where we knew and could validate that problem. And so first, we're just trying to create a solution that really addresses the needs of each stakeholder. And we figured if we could solve it there, that this would echo across and have ripple effect in the system.
I'm laughing because I genuinely, we did not plan to do this. It was funny. Yeah. My mom's here. I remember I called her. I'm like, I think I'm gonna do this full time. She's like, you sure? So it's really, when you think about, we're serving people and it's growing and it's the right thing to do. And we went through accelerators that helped us learn how to take this thing and make it scalable, because it really is something that you have to learn and know how to do. And I think having mentors and being able to go through programs helped us build the bones of something that can be scalable, so that now as we're doing it, we're able to do it and provide a really great outcome.
Yeah, the reason I asked that question, because I feel like some of the best companies and some of the best things comes from really wanting to solve a problem and not necessarily thinking about scale. Like we at Reckitt, we've seen a lot of, especially outside of the country, we've seen a lot of women that are trying to solve problems just in their community and healthcare, just how it affects them and how it works for them. And I find those answers quite interesting, because what you build sometimes that becomes so authentic, and it, eventually it scales to millions. I mean, there's lots of programs and things that we use, social media, that just started just internally, just to text someone upstairs or to tweet someone upstairs, and then it became something much bigger. So I feel like sometimes when you really have a different goal and you just really want to succeed and you really have a great idea, it becomes bigger and bigger and bigger. And then, like you said, Kwame, is like, oh, I need to do this full time. This was never like the intended. I never started out wanting to win 23 Grand Slams. I wanted to win the US Open. And then I made that scalable,
All right, so that's a good transition to, where did that question just jump to? To you, Serena, a question from Jules. You've broken barriers in sports and investing. What advice would you give women building companies that challenge long-standing cultural stigma?
Hey, Jules, if you're still here, hey. What advice would I give to women building companies that are challenged long-standing cultural stigma? I think stigmas and things like that people say are just ceilings that they put on you because they can't do it and they can't change it and they don't want it to change and they really like how things are and they don't want anything to be different. And so I feel like that's the whole meaning of that. And so I built my career just basically around breaking that down. I mean, I'm from Compton, but why can't I be the best? That has nothing to do with playing tennis. It literally has nothing to do with the same. So when the advice that I like to give people is just say, like, don't listen to the noise. As simple as that may sound, like, block the noise, because the people that are really making the noise aren't really making change, or they're not doing anything different, and they're mostly the people that are afraid to be anything. They're just hiding behind a computer or hiding behind a pen or whatever and trying to hold someone else down. They don't want you to be successful. So that's kind of how I always view that.
There are so many good questions. It kills me, but we are going to move to closing thoughts so you guys can all get on to your days in Austin. Ryan, I'll start with you. Would love for just your thoughts on, in this moment, what makes you hopeful about health equity in these challenging times that we're in?
Yeah, I mean, for me, it's the power of partnerships and the inspiring stories you hear here. When we think about, when you think about and hear about what we can bring from Reckitt to bring some of this brand building knowledge we have over the time, the experience that Acumen brings to the table of investing in entrepreneurs and helping them thrive and grow, to what Serena brings to the table through her experience and resiliency, her investing exposure, and all the broad expertise she has. But the real power is when you match up that knowledge with that personal passion and that understanding of the audience they're trying to serve. And we talked a little bit earlier around how can you have impact. The impact comes from people with passion and people on the ground. And when you can surround them and support that, it really can create something bigger than the individual can on its own. One of the things that's always inspired me is a quote one of my mentors shared with me early on, which is the idea of none of us is smarter than all of us. And I love the statement because it's a little bit quirky, but it's definitively true. If the 5 of us worked on something collectively together, we will get to a better outcome than any one individual can do. So for me, it's really this power of partnership and what we're able to do with that to solve bigger problems together.
Thanks. Mika,
thank you.
Across.
Yeah. Thank you. What gives me hope? I would say finding the silver linings. We're living in, I mentioned maternal health outcomes, which is what we live and breathe every single day. Unfortunately, very low, bar can't really get lower than here. So there's only up, but at the same time, finding silver linings. So we hear about, cuts to funding in Medicaid, for example, which is where we serve. But there are silver linings because hospitals that are stretched thin, budgets that are stretched, and they need the technology now, and there's a way to leverage. We're also at the precipice of this next AI revolution. There's a way to use this technology for good and to supercharge the people who have that community-based trust, like in our case, doulas, to do things that they could never do before, and to enable hospitals to serve more of the safety net populations that they serve. And so finding those silver linings and focusing on those, cutting out the noise, as Serena mentioned, continues to give me hope.
I think about 2 things. One, this is an example of organizations coming together to really focus on this problem and rise up some of the people, the products that are really solving the problem. Just already for us, we've been able to go to places, be in rooms, and earn partnerships that we could have never gotten on our own this quickly. That's one really big thing that I'm seeing. And something that's personally for us, we're building something that will allow anyone to be able to access a nursing home, a nursing home, health insurance, medications, et cetera, without having to go through the system. And when we started this idea, the world wasn't really open to it. But now there's energy around making a better safety net, making one that's more accessible to more people. And that's really a chasm shift that we're excited about.
And me, I'm just excited to be here, to be on stage with everyone. I find these founders so exciting. Mika and I share a nickname. My nickname is actually Mika. So I love what...
It's my nickname as well.
Yeah. I love what you guys are all doing, and I'm just so happy that Reckitt decided to, work with me, because I love doing this, and I love, getting on the ground and getting my elbows dirty. So I just look forward to seeing more in healthcare and more stuff with, really great, and helping. That's one thing that I look forward to doing. So, yeah.
Well, thank you to our amazing panelists and to all of you for joining us. Hope that many of you will get involved, and particularly want to hear from entrepreneurs who might be a fit for Catalyst. You can reach out through Acumen America's website. At the very top, there's a note about Catalyst, and would love for you to join us and get involved. To end where I started, we are in really challenging times as a country, but what gives me great hope are the builders who are relentlessly out there every day doing the work, rolling up their sleeves, and helping to make our communities healthier and more equitable, and the partnership of this whole group on the stage to do that together. So thank you, and have an amazing rest of your time in Austin.
Thank you.